All right, hot take. So why don't we offer breast implants at the Alston Clinic? Well, it's because I got into the business to fix problems and not create them. And I personally think that over time, breast implants cause problems and they don't fix them. Why is that? It's this foreign body that's placed in there that exerts a pressure on the breast tissue. And initially, everything looks really great because the breasts are up, they're perkier, everyone's happy. And then over time, gravity always wins. The breast implants will fall, they'll cause the breast tissue to atrophy, which causes them to fall even more. The skin gets stretched out, and then what was once perky is now not so perky and it's down lower on the chest wall. So then what do? You go back for a revision, maybe you need a lift, maybe you go to a bigger implant size, which has more weight, which causes more stretch, more breast tissue atrophy, and you end up getting in this cycle where you're just kind of like chasing breast revisions all the time. To me, I think the better thing to do is to get the implant out, get the breast in a really pretty aesthetic position on the chest wall, and then add autologous fat. So using your body's own fatty tissue from one area and transferring it to the breast. So you've got a nice soft appearing breast that lasts you the rest of your life, doesn't cause any problems, doesn't get infected, doesn't fall down over time. So for me, those are the reasons why we don't offer breast implants, and we're happy to talk to patients about getting their breast implants out, plus or minus a lift, plus or minus fat grafting.